Hey guys, so welcome to our YouTube channel, and today I am posting this new video on embryological derivatives. So this is one of the important topic which is frequently asked in MCQs in any of the competitive exams. So it is one of the memory based topic and you have to just memorize it. There can be some short tricks, but yeah, after all you have to memorize it. So we'll talk about the derivatives of ectoderm, mesoderm and endoderm, and then some specific things which you need to remember, which are some of the beneficial points in MCQs. So here we go. Derivatives of ectoderm. Now in ectoderm we have surface ectoderm, neural tube and neural crest. Okay, so these are the three main subtypes. Talking about the entire embryology involving how these structures are formed, that is a different topic, and it is one of the topics in embryology. But right now we are just focusing on this particular thing, which are the derivatives. So surface ectoderm, the derivatives of surface ectoderms are epidermis, adenohypophysis, lens of eyes, epithelial linings of the oral cavity, sensory organs of the ear, olfactory epithelium, anal canal below pectinate line, parotid, sweat and the mammary glands. So talking about surface ectoderm, you can just remember that everything from the face, that is the lens of eyes, then epithelial lining of the oral cavity, sensory organs of the ears, olfactory epithelium, these are the part of derivatives of surface ectoderm. Other than that, we have anal canal below the pectinate line, and all the three glands here, parotid, sweat and mammary glands, are from surface ectoderm. Adenohypophysis, that is anterior pituitary. That is one of the important differentiating feature when we talk about neural tube derivatives. In neural tube derivatives, we have neurohypophysis, that is the posterior pituitary. Now talking about the neural tube, everything in the brain are its derivatives, like the brain, CNS neurons, oligodendrocytes, astrocytes, ependymal cells, spinal cord. So these are the derivatives of neural tube. All these are cells of brain. Plus we have pineal gland and retina. So that is the thing you need to remember about neural tube derivatives. There is no specific mnemonic here. But talking about neural crest, we have this famous mnemonic, that is emopasses. E is for enterochromaffin cells, M is for melanocytes, O is for odontoblasts, P is for PNS ganglia, that is peripheral nervous system ganglia, cranial, dorsal root and autonomic. While in neural tube it was CNS neurons, that is here in P we have PNS ganglia. A is for adrenal medulla, S is for Schwann cells, another S is for spiral membrane, that is aorticopulmonary septum, E is for endocardial cushions and S is for skull bone. So yeah, we have 3 S and we have this different derivatives of neural crest. Now the frequently asked question is like adrenal medulla is from neural crest, while adrenal cortex is from mesoderm. So the next thing we are going to discuss is mesoderm derivatives. Okay, so everything which we see like muscles, bone, connective tissue, serous lining of the body cavities like pericardium, peritoneum, pleura, even the cardiovascular structures, blood, lymphatics, that is from mesoderm. Spleen is an organ which you need to remember is from mesoderm. Wall of the gut tube, proximal vagina, kidneys, adrenal cortex, dermis, testis, ovaries, microglia, and tracheal cartilage. So you need to remember these derivatives of mesoderm, especially the most important is the adrenal cortex, whereas adrenal medulla is by neural crest. Spleen is one thing that is frequently asked. Okay, now we'll move on to endoderm derivatives. So the gut tube epithelium, including anal canal above the pectinate line. Most of the urethra and the distal vagina derive from urogenital sinus. All these organs, lungs, liver, gallbladder, pancreas, eustachian tube, thymus, parathyroid, thyroid follicular, and parafollicular cells. So spleen, you need to remember it's from mesoderm. Otherwise, lungs, liver, gallbladder, pancreas are all from endoderm. Also to the gut tube epithelium, and all these thyroid things and thymus things like thymus, parathyroid, thyroid follicular, and parafollicular cells, they are from endoderm. So this was all about particular derivatives. Now there are few differentiating features. In lungs, the alveoli, epithelium of the trachea, and bronchi, they all are from endoderm. But the airway cartilage, which we learned, tracheal cartilage, is from mesoderm. This one, it's from mesoderm. Otherwise, alveoli, epithelium of the trachea, and bronchi, they are from endoderm. Talking about pituitary gland, interior is from ectoderm. It is from Rathke's pouch, and the posterior pituitary gland is from neural tube. Talking about adrenal gland, the cortex is from mesoderm and the medulla is from the neural crest. So that those were some differentiating features. And that's all about embryological derivatives. So please like